And we are live. Hello, everyone. Welcome and thank you for joining us for our special educational symposium sponsored by Aurinia Pharmaceutical. My name is Kelly. I am the creator and executive director of the Portland-based nonprofit More Than Lupus. If you are unfamiliar with More Than Lupus, we are a multi-ethnic, multi-generational, and international lupus community designed by lupus patients to connect, to grow, and to inspire each other throughout the peaks and valleys of our lupus journeys. And I say "our" because I have lived with systemic lupus and multiple lupus overlap conditions since the age of 11. Now, we believe that every person living with lupus, no matter their background, should be treated with equity, dignity, and taken seriously. And it's our mission that patients feel heard, seen, and valued. It's also our plan of action to continue to spotlight minority populations disproportionately affected by lupus and lupus nephritis. Today's event will spotlight the unique challenges of people living with lupus nephritis. And we hope the information provided today can be used as a resource that hopefully propels you to have an open and honest conversation with your doctor. By the way, I see people start to log on right now. Please share this live event on your Facebook page so that people can get connected to community and support and have access to some of the incredible information and resources that will be shared today. Now, before we continue, please allow me to give you a brief disclaimer. Please understand that the opinions shared today are purely for informational purposes and do not replace the medical advice and/or opinions of your doctors. If you're experiencing lupus, lupus nephritis, or lupus overlap symptoms, it's important to follow up with your doctor and to seek the treatment that is best for you. Our panelists are qualified professionals. However, they are not liable for their comments since they are not acting as your personal physician or as your personal health advocate. It is time that we as a patient community delve deeper into this conversation, and I am thrilled to welcome Danny, Strategic Alliance Manager and Advocacy Representative for Aurinia Pharmaceuticals, here to introduce our speaker, Dr. Alvin Wells. Thank you, Danny.
Good afternoon, and thank you, Kelly. My name is Danny Martinez, and I'm the Strategic Alliance Manager with Aurinia. And I'd like to thank Kelly and More Than Lupus for the opportunity to partner with them. And welcome everyone for this afternoon's discussion on Get Uncomfortable, Prioritizing Lupus and Your Kidneys. As you may be aware, Aurinia makes the medicine for adults with lupus nephritis. However, today's presentation will not discuss any medicines and will focus on the importance of early detection through routine testing and the management of lupus nephritis. We look forward to sharing information about our medicine at a future program. At this time, it is my pleasure to introduce your speaker for this afternoon's program, Dr. Alvin Wells. Dr. Wells is currently a practicing rheumatologist and the director of Aurora Rheumatology and Immunotherapy Center in Wisconsin. He is an adjunct clinical professor at the Medical College of Wisconsin. He also maintains his clinical affiliation with Duke University, where he is an adjunct assistant professor. Dr. Wells received his medical degree from the University of South Florida and trained in internal medicine and in rheumatology at Duke University. He received his PhD in immunology from the University of South Carolina. Dr. Wells has over 25 years of research experience focusing on chronic inflammatory diseases. Dr. Wells is an internationally renowned speaker and researcher and has had research support from the Arthritis Foundation and from the Robert Wood Johnson Foundation. And with that, Dr. Wells, you may begin.
Thank you, Danny, and thank you, Kelly. And first of all, welcome to all of you. I'm excited to kind of share this information with you today. And we titled this Getting Uncomfortable. We use the term, peeing in a cup might be bad, but getting lupus nephritis is even worse. So what I'm going to do is give you some pearls, stuff that I do on a daily basis with my patients in my clinical practice, and stuff that you need to talk with your clinicians about, with your family members, with your friends. You might know somebody at church, at school. You might have somebody who has lupus. And wait a minute, my doctors hadn't talked anything about the kidneys. So we want to talk about what that looks like and go through as well. Like Kelly said, my goal here is not to give medical advice, is to empower you. Write down questions, talk to your doctors, come in and think, and you'll learn some stuff if we go throughout the program here today. So prioritizing lupus and your kidneys, and this is a discussion, and we're going to keep coming back to that cup of the pee here that we have there. Kelly, next slide. And next slide. Yeah, I'm a busy rheumatologist. I live in North Illinois and practice over the border in Wisconsin. We see almost 300 patients a month. I treat both adult and pediatric patients, and again, patients who have lupus. We first want to understand lupus and lupus nephritis. Many of my patients say, hey, what did I do to get this? You didn't do anything. It's your body's immune system. I say when you're young and healthy, you're balanced like a scale, right? Everything's in balance. But what happens with lupus, something hits a switch and everything gets off balance. You get these angry cells that are turning in the bloodstream, and they cause that rash on the face. They can cause the hair loss. They can even cause the sores in the nose and mouth. And left unchecked, those angry cells can get in the kidneys, and we call that lupus nephritis. Next slide. So lupus is a systemic disease. It is a chronic disease, guys. Once you have that diagnosis, the bad news is that you have it for the rest of your life. The good news, we can do something for that. We have medicines now that I didn't have years ago. Like Danny mentioned, when I did my fellowship at Duke and when I was attending a physician there, I did not like to treat people with lupus because they were sick and I didn't have many options. Now we have so many options that we can use to treat our patients, and that's what we're going to highlight here today. Next, we see in the middle there, the inflammation caused by lupus can affect many parts of the body. Everybody talk about the skin. Remember, lupus comes from the Latin word that means wolf. You get this rash in your face that looks like a wolf or a German shepherd. You guys all know the singer Seal. Those kind of scars in his face. That's not coming from scarring acne. That's what lupus can do. So we can see stuff on the outside, but we get word as a rheumatologist what it can do on the inside. It can affect the brain. It can affect the heart, the lungs, and it can affect the kidneys. And in the middle there, you see the little kidney buttons, like a little kidney beans. When lupus affects the kidneys, we call that lupus nephritis, and we abbreviate that LN. So the symptoms of lupus nephritis they're not noticeable. And many people don't know that they have it. Now they can sneak up on you, and they can be very, very serious. Next slide. So what about the kidneys? The kidneys, as you know, the vital organs. I said the kidneys are almost like a dam. They're there tight and not to let things get through. When the body's immune system damages those kidneys, guess what? They get leaky, and then things kind of goes through. And when they get damaged, they almost get scarred. I make the analogy like a sponge. You guys ever been to the store? You get one of those nice sponges and a little plastic bag cover, and you take it off. It smells good. It's nice and smooth. It absorbs the water. But over a period of time, when it gets all hard and cracky, guess what? It's not going to do its job. You might as well just throw it away. And that's what happens with the kidneys. Lupus nephritis is very common, and it's a serious complication that causes from the inflammation of the kidneys. And when your kidneys can't function properly, neither can other organs of your body. Stuff builds up in the bloodstream, and it can cause more side effects throughout the body. Next slide. So lupus nephritis can be silent. We call it the great mimicker, because people say, well, I got a little swelling in my feet. Yeah, I've gained a couple pounds. I need to stop eating, the waffles or whatever. But no, it's not it. It could be coming from the kidney disease. Inflammation caused by the lupus can affect the kidneys. Look on the right-hand side here. 1 in 2 people with lupus may go on to get lupus nephritis. Think about that. Half of the people who have lupus can go on to get lupus nephritis. And I'll show you some numbers too. If they get that and not get the kidney disease treated, they can go on to get kidney failure. So on the left-hand side here, you see early diagnosis and treatment of lupus nephritis is crucial. I always tell people I have a boy and girl twin, and God forbid if my kids got lupus, I want to make sure they get being monitored on a monthly or every 3-month basis to making sure they don't go on and get any kidney changes. And that's what you should be expecting from your rheumatologist, from your primary care, and from your nephrologist. Next slide. So here's some uncomfortable facts. Up to 1 in 3 people living with lupus may experience kidney failure. I unfortunately have my older sister who's just started dialysis last year, and that's no walk in the park, guys. You got to go to that dialysis center 3 times a week. You can't travel because you're going to be out of town, but no, you got to go next day to get your dialysis done. And we know, look at the second bullet point there, the risk of death is 3 times greater if you have lupus nephritis. So if you have lupus, but if you have lupus nephritis, you're 3 times more likely to die. You die from heart disease, you die from infection, you die from a lot of different things. Why did I mention my daughter? Look at the third bullet point. Lupus nephritis is more common in some racial or ethnic groups. 4 times more likely in people of African or Asian descent, and 2 times more likely in Hispanic or Native people. So we tell people, yes, we're going to do an exam on you. Yes, I'm going to do the blood work. But yes, I also need the kidneys functions, and that's why the urine comes in. Luckily, there are steps that you can take, such as scheduling routine visits and ask about these treatment options. Next slide. So managing lupus nephritis, I like the quote here on the right-hand side. It said, it's time to get real. Lupus nephritis patients have many odds against them, but we do have the power of choice. We can do our part, meaning you as patients. Next slide. So how do you monitor the signs and symptoms? So as a rheumatologist, what am I looking for? Like I say, I usually see my patient every 3 or 4 months. Now I'm so busy, I'm seeing them every 6 months. But we do my examination. I do the blood work, but I'm also going to do some kidney tests, and that's going to be looking at the urine. So urine test is the most common one that we look at, and we check for normal levels of protein. For example, like I said, the kidneys act as a dam. If that dam has been damaged, meaning the kidney has been injured by lupus nephritis, they become leaky, and stuff that we should not see in the urine now appears in the urine. That means the kidney's been damaged. Going back to that sponge I talked about, it's not absorbing, it's not blocking stuff like it should, and it's going on. So we look at the second bullet point. We will look at something called the protein in there, and it should be a half a gram, 0.5 grams. That number you don't need to know about, but I know as I'm looking at that number, it continues to go up. Whoa, I need to roll my sleeves up and go in there and make sure we get the kidney disease under control. In addition to the urine, we do some blood tests as well. There's another thing called the GFR, the glomerular filtration rate. And to make the analogy there, you ever have a water hose versus a fire hose? That fire hose is shooting the water out at a lot faster rate. It's going faster, right, compared to a regular hose. We know that with the kidneys of function, 2 healthy kidneys, that kidney should be functioning at a certain rate. And that's what we can look at when we check in the blood test. And then sometimes we need to go in and do a kidney biopsy. There are 6 different types of kidney disease that's caused by lupus. And the different types is I'm going to treat them a little bit differently. So what we do, have the patient go into the doctor's office. They lay on their stomach on a table. We give some numbing medicine, the same thing that a dentist uses when you go in for a tooth pull or filling of your teeth. And then you go in with a small needle at the back of the lower part of the back and get a biopsy of the kidneys. And then we send that to the pathologist, and they look at that under the microscope. Yes, you have type 3, you have type 4, you have type 5 kidney disease. We know what to do. On the right-hand side is a QR code. You can scan that if you have a smartphone. I like one of my patients said, I don't have a smartphone. They said, my phone is only of average intelligence. So she couldn't take these codes for her. So we can print things out for her as well. But the guidelines talk about how we should be doing. We should see a patient every 3 months. Think about this. I know it's, like I said, it's a chronic disease. You will have to see a physician. You will be on medication, and you will have to take labs and everything. But if I'm only seeing you every 6 months, I still need the blood and the urine test every 3 months. Because if I see you today and I wait 6 months from now, your kidney function could be so bad and the cat's out of the bag, and I can't do anything to reverse that. You got to have it done every 3 months. If you're a patient with lupus, oh, my doctor said my lupus is fine. I got mild lupus, not checking anything. There's no such thing as mild lupus, guys. It's either lupus or it's not. And they need to be checking you. They need to be following you. Like I said, if my daughter had it, I'm not going to tell you, yeah, honey, you got mild lupus. I'll see you in a year. No, I might see her in a year, but every 3 months I'm doing blood work and urine because it could sneak up on you. And I'll show you what that looks like. Go to the next slide, Kelly. So what are the symptoms that we look for? Look at the second bullet point. This is the thing to look for. So again, imagine the kidneys, they're not working like they should. Things become leaky. You can't get rid of fluid. That sponge is all hard and cracky. It's not going to absorb everything. Guess what? So you get swelling of your legs and your ankles. A lot of us, as you get older, you take your shocks off at night. You have that little line around the ankles. That should be going in the morning. But if you see that line around your ankles when you get up in the morning, that means the fluid is not being absorbed. That's a red flag. You need to be calling your doctor. Because when the fluid builds up, guess what? It makes the blood pressure go up. And one of the bad things about the blood pressure going up, you can have more heart attacks and strokes. And unfortunately, that's what killed a lot of our patients with lupus. The urine also becomes frothy or sudsy, and also people have to go to the bathroom a lot more. I'm old enough to remember, as a kid, we would drink milk for meals. I don't know the last time I drank milk anymore. But we put that straw in the milk and we blow in that milk and make all those bubbles as a kid. That's what the frothy urine looks like. You go to urinate, you look down the water and say, oh my gosh, where are all those bubbles? It's not coming from an infection. It's nothing from your body. It's coming from the lupus. So if you go into the bathroom a lot, when you urinate, you say, wow, I got all these bubbles in there. That could be a sign to let your doctors know about it. You may not notice the signs of damage in a little box here, but routine blood tests, routine urine tests allow me to stay on top of things to go from there as well. And let me talk about the appointments, guys. I know it's busy. I mean, I try to get into my eye doctor to get my contact or my dentist to get my teeth cleaned, and I'm missing appointments left and right. I'm always having to reschedule. Lupus is a real deal disease. And here's one little pearl I'll share with you. If you got a busy day, you got kids you got to take to school, or you had a sick kid you had to stay up with all night. Oh my gosh, Dr. Wells, if I got to have an appointment at 9 o'clock, I hadn't slept all night. Skip that appointment, call the doctor and say, hey, Dr. Wells, can we do a telephone appointment? And they're going to say, no, no, no. But you're going to say, yes, yes, yes. And if they say they can't, then you need to find another doctor. Indeed, for example, my no-show rate has gone down to 0. Because if a patient doesn't show up, my medical assistant will call that patient. Mrs. Smith, you missed your appointment, Dr. Wells, at 2 o'clock. Do you mind if I get him on the phone? We can do this all by the telephone. So I can see how they're doing, talk about the medications, see if they get their blood work in their urine. And then I'll say, hey, let's get you back in here in another 3 months. You see how it's done? So life happens, but don't take your health for granted. You say, yo, I missed that appointment, Dr. Wells. Let's get you on, do a telephone. We love to do a video like we do here as well. But if you can't do a video, you can do a telephone call. I'll give you another good example. My mom, she's 89 years old in South Carolina, doesn't have internet. She has a regular phone, and she's going to a doctor to get an MRI. I said, Mom, when you go to the doctor, they're going to want to get you back in there to go over the results. So you tell them you don't need to drive back in because it's like a 30, 40-minute drive for her. I said, you don't need to go back in there just to go over the results. You say, you asked them, can you go over the results by telephone? So sure enough, she gets the scan. She's leaving the office, and the lady at the reception said, okay, you need to schedule a follow-up appointment to go over the results. Well, no, I would like to do it by telephone. They said, no, you couldn't do it. So, okay, my mom leaves the office and she calls me. And of course, I just make one call. And I said, of course you can do it. It's covered by Medicare. It's covered by insurance. And again, I don't need to go and, hey, yes, your test was negative or positive. Okay, see you. I mean, why do you need to go in the office for that? Do it by the telephone. Do it by video. So if your doctors are not doing that, that's what the future is going to be. And you need to make sure. So don't miss your appointments. Don't take your life, for your disease for granted, because I'm not, and I wouldn't do it if it's somebody in my family. Next slide. So how do you get prepared for your doctor's visit? You got to write down some questions, guys. I'll give you a good example. There's a TV commercial out there showing a guy, he's going in to buy a new cell phone, right? Going to Best Buy, I don't know, wherever you get the phones from, right? And he had all this question. Okay, can I do text? Can I take pictures? Can I do email? Can I do whatever? And then they showed the same guy going to his doctor. The doctor said, you have any questions? The man said, no. It was like silence. So he asked more questions about his cell phone than he did about his health. And the take-home message there, guys, if you're going to be asking all those questions about a cell phone, about your car, about some clothes or food, you need to be asking the same thing with your doctors. So get prepared for your appointments. If you got some of the pharmacies, for example, Walgreens and CVS, hey, I'm going to my doctor's appointment. Can you print out a list of all my medications that are getting filled by you? And you can take that to the doctor so I can review that. I'm going to compare your list with what I got on my computer to make sure they match. That's something you can do. Write those things down. Okay. I'm one of the guys say, hey, if you need to bring somebody else in the office with you, bring somebody else in there. Now be prepared. You bring somebody else in the room. I'm going to ask some personal questions. So if I ask you about intercourse and all this other kind of stuff, you need to know about that as well, because that plays a role in what we're doing. So anybody in that room need to be able to share that same personal information with you. Here's another little pearl. I see kids as well and young patients in school sometime and say, hey, 18, 19 years old, they're in college. And they can't make it to the office. And I want to have my mom or my dad on the phone, or they want to record it. I say, absolutely, you can record it. And some people say, oh, no, you don't record it. I'm not going to say anything that I want you to repeat, that you don't want to share with somebody in your family. And this is the technology that your doctor should be doing. You see on the right-hand side, it says take a friend or family member, keep a list of all your medication, including vitamins, guys. Some people don't think that, hey, the vitamins and supplements and all the stuff you're taking. So the turmeric, curcumin, coenzyme Q and all the stuff that you're taking. I need to know about that. You got to be your own health advocate and ask those questions. Write things down, bring somebody with you. At the end of the day, if you need to record this, so hey, gosh, I can't remember what the Dr. Wells, I talk fast, you hear me now, right? But I talk as fast as I do. I write in the room, I dictate it, and then I turn around and say, Mrs. Smith, I'm going to go through everything, what you hear. I'm going to dictate it so you can make sure I have everything correct. And then I put my microphone down and say, do you have any other questions? And they get a printout of everything that we talked about. They know the appointments. They know the labs they're getting. They know the refills they're getting. They have the updated medication from me. They have everything that they need. So the pearl here, make sure your pharmacist has a list of all the medication. You can get ready for your appointments. Write down questions that you might have for your doctors. Hey, I saw this TV commercial. Is this drug good for me? Hey, I have a friend at church who's on this medication. Can I take the same thing? Write that down. Bring a friend or a family member. Be prepared to share personal information. And if you need to record that conversation, absolutely. Next slide. Getting uncomfortable. Tony Braxton, I love her. I love her music and everything. She says, I see my doctor at least every 3 months for urine and blood tests. That's what I've been talking about, to make sure the level of protein in my kidneys is being monitored carefully. You got to make sure that is being done. I don't care if you have don't have any kidney disease. That's good. But I'm worried that you might develop it at some course. Remember, 1 in 2 people will go on and get, with lupus, will go on and get lupus nephritis. They got to be doing the urine test, guys. And I get on my rheumatology colleagues, they're not doing it for their patients. And think about this, your patients are my customers. They're paying money for my best advice. And I'm gonna give them the same advice if somebody in my family. And that's what we do. So Tony Braxton talks about here, don't be afraid. Oh, Dr. Wells, I did a urine last month, 3 months ago. Do I need to do it again? Yes, you do. If you're not, I'm gonna say find another doctor, because I don't feel comfortable treating you in the blind, treating you in the dark. What would I do if you're my daughter or somebody in my family? And that's what we tell our patients as well. Next slide. Managing lupus is hard, but it's worth it, guys, because we can do stuff for it now that we couldn't do years ago. I mean, it really is kind of rewarding to see somebody come back in. I tell the story, when remember the whole thing between Will Smith and Chris Rock, and they said Will Smith's wife had alopecia. I'm looking at her hair. I said, gosh, she really don't have alopecia, because I was about to call her up. I said, hey, if you have alopecia, I can get this better. So managing some of these symptoms of lupus, we got stuff we can do. Don't be afraid to come in. Don't be afraid about your hair, your skin. I got amazing things that we can do for these now. Peeing in a cup sucks, but getting lupus nephritis is even worse. So we need to get people uncomfortable and make your providers uncomfortable too. Talking about what to do. Because remember, part of my job is not just to talk about the blood and the urine. I'm gonna say, hey man, you need to lose some weight, and here's how I'm gonna help you do it. I need to put a consult in for a nutritionist so they can tell you about healthy foods and stuff like this as well. If I need to get you a weight loss program, all this stuff is covered by the insurance, guys. But sometimes the insurance, the primary care, oh yeah, just go out and lose some weight. Oh yeah, go learn how to eat healthy. No, write the order so I can see a nutritionist. It's covered by my insurance. Write the order so I can get on one of these weight loss medications, and it helps jumpstart this stuff. So schedule these routine visits with your doctors. If you have a question, you don't need to see it face to face. Hey, Dr. Wells, I saw something about weight or nutrition. Can I get a referral? Yes. I do that right there on the phone, 2 seconds. And that's the thing you do. That's what you're paying me for. And I tell you, you got to make sure your providers are doing the same thing. Here's a scan. You can scan that with your smartphone. And the website there is getting uncomfortable. But, this is where we really are. And you think about empowering people who have lupus and lupus nephritis to make sure that the disease is going to be under control. Next slide. So Kelly, why don't we stop there, and you want to get back on? Let's talk with the team. This is the part of the program I like, because I get to interact with people and ask the questions. And Kelly's going to tell you how to put your questions in.
Wow, that was a lot of wonderful information. Thank you so much, Dr. Wells. Some sobering things too about, 1 in 2 lupus patients having lupus nephritis, and 1 out of 3 lupus patients having kidney failure. I think they're incredible reminders, particularly when lupus patients can get a little bit maybe frustrated with peeing in a cup, or annoyed with having to have their labs done, the same labs checked every 3 months. But as you say, it sneaks up on you. It really does. We have a lot of people joining from all over the US today, from coast to coast. And there have been some good questions coming in. So I'm going to start with the questions that were pre-submitted to us, Dr. Wells, and then we will go to the chat box. But thank you everyone who's been watching this and joining along thus far. First question, if you could make a list of your top 3 things that every LN, every lupus nephritis patient could do to be proactive with their kidney health, what would they be?
Yes. So first I would say is your diet. We know that certain foods can actually irritate the kidneys as well. So like talk about salt, talk about all these processed foods and everything like this. I know food is expensive now, but you want to do fresh, healthy diets. I'm not a big fan of vitamins. I tell people in the old days, our grandparents couldn't go to Walmart or Target to get vitamins. Vitamins have colors, they got fillers, they got all the stuff in it. You need to eat fresh fruits and vegetables. Instead of taking omega-3, eat salmon 3 times a week. I limit myself to a hamburger once a month. My weakness of fries, but that's the first thing is getting your nutrition. Hey, Dr. Wells, I don't know how to do it. What's carbs? What's protein? I can write a consult for you to do that. So that's the first thing. The second thing is making sure the rest of your body is healthy too. We talk about your weight, your blood pressure, and sleep. If you're not sleeping well at night, none of my meds are going to work for you. You need 6 to 7 or 8 hours at night to allow your body to recover, to repair itself. So sleeping well is important. And if you don't sleep well the night, you go to another. So I get on some of my calls. Well, Dr. Wells, I don't sleep well at night. I take a sleeping pill occasionally. If you don't sleep well, ask your doctors for that because your immune system, your body needs to repair itself at night. I need to make sure your weight and your blood pressure is under control. And then third, you need to see your rheumatologist for your lupus. So some things you can do on your own. If you need help from me, like making a consult for nutrition, you can do that. Making sure your weight and blood pressure are good and that you're sleeping well. And third, making sure your all diseases are under control.
Wonderful. The next question that was pre-submitted, I think this is a really important one because of the nature of lupus nephritis. What is one symptom of LN that most patients ignore?
Yes, if I had to say what is the number one symptom that most people know, they got a little swelling in the ankles. And they say, oh, yeah, well, I just ate some salt yesterday. I had fries last night, or I had some chips, for lunch, and they blame it on their diet. And then that swelling gets worse and it continues and can down the gain 1, 2, or 3 pounds. So that's the one thing that they ignore, that weight gain, the fluid retention, because that means, hey, guys, your body's not processing fluid like it should. Remember that sponge I talked about? It's not going to dry that water up off the counter when it's all hard and cracking. And that's what happened with the kidneys. So don't ignore that. Like I said, take your socks off. You see that little ring around your ankle, it should be gone in the morning. If it doesn't, take a picture and you can show that to your doctor. Hey, this is what my legs look like. Is that normal? If they say it is, you need another opinion because it is not normal.
Yes. I love that sponge analogy too. I think that is such a good visual. Oh my goodness. Okay, so it's scary. This is a lot of information. As you said, lupus is a real deal disease. There's no such thing as mild lupus. You either have lupus or you don't. Yeah. So once a patient is diagnosed with lupus nephritis, is remission possible?
Yes. And when we talk about remission, we want people to get what we call a complete response. Meaning I'm going to hit you. I'm going to throw the kitchen sink at it, meaning multiple drugs, include whatever I can to get that response under control. I showed you a slide saying there's so much protein. The kidneys are damaged. You shouldn't have protein in your urine. I want to see that protein, if it's there, it should go down, go into a normal range. And that's what I'm looking for. So we can treat it, and some people can go into remission. The only challenging part, not everybody, and this is why we've learned over the years, the sooner we get that patient to remission, get that sponge before it's got more scarred and damaged, so that sponge can continue to function. I want to get that kidney disease today and get it under control. I don't want to wait 6 months or a year before now you got kidney disease. I'm going to throw something at you.
Interesting. So it's being proactive instead of reactive.
Yes.
I know you mentioned diet already, and one of the questions pre-submitted was, how does diet and a healthy lifestyle improve LN outcomes? Now, I know you already went into that, and I don't want to make you repeat yourself, but is there a particular lupus kidney regime of things to eat and things to avoid that you would recommend to your patients?
No, this is why I really rely on my nutritionist sometimes to get the patient, hey, give you some pointers. They give you some, they say, hey, get for next week, write down a log of everything that you're doing, that you're eating and drinking too, guys. This is one of my biggest pet peeves. If you guys are drinking diet sodas, you need to stop. Okay, let me tell you why. Diet sodas have artificial sweeteners in it. And your body is smart. When it's these are a chemical, your body is going to pee it out or stores it for use later on. And all the studies have shown since we've had diet drinks, guess what? Obesity has gotten worse. So you go to the 7-Eleven or Speedway, you say, hey, I'm going to get that big gulp, 32 ounces of a Diet Coke. Your body's storing all that stuff. It's doing more harm than good. So we talk about, again, limit the amount of carbohydrates. That's the white stuff in your body that you eat, like the rice, the pasta, the potato. What you want to do instead, eat the sweet potatoes. Instead of mashed potatoes, eat mashed cauliflower. If you want cereal, say, let me just have the cereal oatmeal maybe twice a week. Your breakfast should be protein, eggs, avocado, cheese, turkey sausage, all those kind of things. And like I said, fish at least 3 times a week. If people are not pure vegan, the beans, the lentils, all the leafy green vegetables, kale, Brussels sprouts, spinach, all of that stuff. Most stuff is expensive now. I can almost guarantee you some of you spend more money on vitamins than you spend on some fresh spinach or some fresh cauliflower. So think about that. And these vitamins, like you say, don't know. Let me give you a pearl about a vitamin. If you want a vitamin to see if it's working, take 1/3 of a glass of vinegar and put the vitamin in there. Wait 30 minutes. If that vitamin hasn't dissolved in 30 minutes, you just wasted your money, because that's the vinegar, the same acid is in your stomach. And when it breaks that vitamin down, it means it's working like it is in your stomach. You say it's been there for a couple hours, it's still there. You might be wasting your money.
Oh my goodness. That is a sad fact that our bellies are all backed up with vitamins that are not doing us any good and costing us a lot of money.
That's true.
Oh my goodness. Oh my goodness. Okay. I love this question. Obviously, this is a patient-led and patient-focused organization. So what are the questions that you wish your patients would ask you?
I wish they were more involved with their medication. I have some people come in, they're not really sure of all the medications. And it's not just my older patients, a lot of young patients. I had a 19-year-old patient came in. Man, I was impressed with her. She was on the ball. She knew her medication. She knew the dose. She knew everything. It's amazing. And that's what I wish many people do. The sad part in the U.S., I mean, I know literacy is an issue. Not everybody reads these terms and know these words and know what it's for. That's why I say rely on your pharmacist. That's what you're paying for. You say, hey, I want to print out for my mom's all of her medications that you're being filled. And that way you can see, and it goes in, because my computer doesn't always talk to a CVS or Walgreens or Meijer or Walmart. I want to make sure that when you, all the stuff that you're taking matches what I have on my records. I wish everybody knew their medications. And so that's one big thing. The second thing is wish they knew, hey, when my disease is flaring up. I'll give you one example. You go to bed tonight, you say, I'm gonna sleep 6 or 7 hours. You get up, you have lupus, you get up in the mornings, and you feel like you've been hit by a truck. So one thing that we see with our patients is the fatigue. The fatigue would be the first symptom that we see. I mean, and then we know, then you get a fever, then you get a cough. You go to the emergency room, this just is a virus, go take some Tylenol. No, if you got lupus, I'm giving you steroids, I'm giving you antibiotics. I don't want that lupus to flare. Know your medications and know your body. You know your body better than anybody else.
Yes. Yeah. Wonderful. It's so great to hear someone, such an esteemed professional as yourself, to say that to a patient population about reminding us that we are the experts in our own bodies, and health literacy improves health outcomes. There's no doubt about that. Okay, so let's go to the questions, Dr. Wells, in the chat box. There's one here that is related to lupus nephritis. So this is from Trisha. Trisha, tell us where you're joining from. Love having you here. She says, what is more important, lowering protein loss and blood pressure, or lowering creatine and GFR? Struggling with ramipril dosing.
Yes. So this is the time I want you to reach out to your provider. And so if you're my patient, I got to get that creatinine level low, because that means the higher that creatinine number is, that means the more the kidneys are being damaged. I make the analogy, I won't say a gun now, but if you had a slingshot, I'm picking off the roads to the kidneys. Every time that slingshot hits the spot in the kidneys, is damage to the kidney. I can't repair that. The higher that creatinine is going up, that means I'm getting more, and that affects your GFR. So instead of going through like a fire hose, stuff is only going through like a little water hose, and that's because of that. The Ramapril is a good drug. It's what we call an ACE inhibitor. We have other ones, but I don't know your race. But for some of my patients of color, those medications don't work the best, and you have side effects. So other types of medications that you can ask your doctor about, something called an ARB, angiotensin receptor blocker, ARB. So it's definitely important to lower the protein loss, but the blood pressure, controlling that, like I said, to help control the blood pressure, sleeping well at night, controlling your weight. But that creatinine has got to be lower, and we got to get that GFR under control.
I hope that's helpful. She is joining from Vancouver, Canada.
Oh, wow.
Mm-hmm. We have a lot of people commenting on your mention of the importance of not missing your doctor's appointments and doing virtual appointments if necessary. Lupus Spoon says, my new rheumatologist appointment is this Tuesday, and we'll have our first video appointment. If I don't keep that, I won't see him until the end of May. He was making sure I'm available for this Tuesday. I love him. He shows me that he cares about me. Well, that's good. Thank you.
And that's the key way to do it. Because like you say, some of my patients, I only see them once or twice a year. The other time is going to be virtual. I'm still getting their blood work done. And if your doctors are not doing that, guys, because like I said, we all work, we all are busy, and you need to make sure that they can provide this service. This is where the future is going to be.
Mm-hmm. Mm-hmm. And another comment from Lupus Spoons, and she's joining from Chicago. Dr. Wells, you're so right about sleep, because I've been using my CPAP machine and I've had less flare-ups. Have you noticed that with your patients, Dr. Wells, with the CPAP increasing sleep and decreasing lupus symptoms?
Yes, because just like I said, at night is when your body's immune system recovers. And if you're not sleeping well at night, you waking up, you feel like you've been hit by a truck, your disease is going to be more active, you're going to have more flare. I got a little upset with one of my colleagues in my department. I was talking about, sleep medicine. She said, well, I'm a geriatrician and we don't believe in sleep pills. I said, whoa, whoa, whoa. I'm 63 years old and I take a sleep medicine occasionally. If I don't sleep well at night, there's no way I'm able to function in the clinic the next day. It's not something you need to take every day. There are newer medications that are out there. But if you have a difficulty sleeping, your doctors need to have you on some medication that you can use as needed. And definitely if you have sleep apnea with the CPAP machines, it really changed your life.
Mm-hmm. Mm-hmm. Thank you for adding to that. Yeah, I think that is everyone else is saying hello from Chicago.
Nice.
We got people joining from South Carolina.
Wow, that's where I grew up.
Oh, wonderful. Yes, we've got, people from, I think she's in the East Coast here, Texas, wow. Lots and lots of people joining today. Well, as we wrap up.
Kelly, let me share one more thing, because this is something I always like to do in my talk to too as well. Say there's a new drug that's out or a new procedure that you want to get done. And I'm telling all my lupus patients now, they should do something called the coronary scan. It's because the thing that kills some of my patients with lupus is cardiovascular disease. So they could be running and jogging. Next thing you know, they have a heart attack or stroke because they got calcium buildup in the hearts. So anybody over the age of 40, I recommend they get that calcium test done. It's covered by the insurance, because I don't want you to, at 42, 45 years old, end up having a heart attack or stroke that I could have picked up. So you go to your doctor and say, I want the coronary CT scan. I heard Dr. Wells talk about that. They said, no, Mrs. Smith, I don't think you need it. That's not indicated. I don't think you need to worry about that. Okay, well, thank you, Dr. Jones, for your concern. Do you mind just putting that in my chart that I requested that test and that you didn't think it was appropriate? So that way you got some documentation. You got them to say, hey, I wanted this test last year. You didn't do it. Now I've got a heart attack or stroke. So you see my whole point. If you're requesting a test, a medicine, or a lab, and your doctors are not doing it, just say, don't be argumentative. Say, just write that down. Do you mind just document that I requested that? Or can I record you saying that you didn't think it was appropriate? Because at the end of the day, guys, that's what you're paying me for. Yes. You're my customer. And that's why I get so mad at my colleagues. They don't see it that way.
Good. So affirming to us. Thank you for sharing that. Well, I'm sure a lot of people watching today, this is the first time that they are seeing you and hearing you. Where can they find you? Are you on Twitter? Do you publish any of your findings? Do you have a website? We'd love to connect with you outside of this.
Yes, I won't go for personal reasons, but I cancel my Twitter account. If anybody reach out, I can tell them why. But I'm on everything. I have a TikTok, I have YouTube channel, Instagram, and LinkedIn as well. And you can look at rheumatology has an advice resource, rheumatology.org, O-R-G. That's where you can find a rheumatologist in your area. If your patient need second opinions, video opinions, all the stuff. I'm not looking for business. I'm just telling you that you can find doctors in your area who specialize in lupus, who are doing things. Another resource we like to use, again, I like Kelly's site here more than lupus, the Arthritis Foundation in your areas too. Say, hey, are there trials going on lupus? Who are some lupus experts that I can be referred to? That's what they did. That's what the Arthritis Foundation does. Not just arthritis, but all of our diseases. But yeah, I'm out there, and Alvin Wells, and there shouldn't be many other ones out there. Somebody said I look like Denzel Washington, but no, I'm not Denzel Washington.
Oh, that's so great. We do have one question and one comment before we wrap up.
Yes.
So Trisha's asking, is calcium scoring good enough, or CT waits are so long?
So yeah, I think the calcium scores are good enough. For example, if somebody has risk factors, like they got a heart disease, they're overweight, they got a family history, I might even go a step further. Hey, do you need an angiogram? Things like that. But yeah, the calcium score is good enough. For example, I had mine done, I think 4 years ago. And then that tells me it takes 20 years for the calcium to build up. But if I'm seeing some calcium there, then I'm going to do one looking at the carotid arteries just to make sure I don't see anything there. So I'm using this first because it takes 20 or 30 years for this stuff to build. Yes, it's a good start, but I'm doing that together with your weight, your blood pressure, your cholesterol, all those things to make sure the CT waits are so long. We find that in some areas they have these standalone places where you can go, but only for a couple of $100 they can get a CT scan done. I had mine done for $49 with our group. They can take a while, but you just need your doctor to order that stuff for you now so you can have that. Definitely people with lupus and any patient in general, just over the age of 40, if you're young and healthy, I think that's a good test that should be done. It's preventative. And you want to prevent heart attacks and strokes, and we have the tools to do that.
Yeah, yes, absolutely. Mungshin said, thank you so very much for such a great talk, Dr. Wells. Thank you so much for the great questions, Kelly, and other lupus warriors. Actually, I went to Dr. Wells' talk hosted by Lupus Heartland chapter in St. Louis last year. He had a great talk then as well.
Thank you.
You got some fans.
I know. Thank you so much. And I love her picture.
Lots of fans. Well, yeah, thank you. And everyone's saying thank you. Well, I just want to add to that gratitude and say thank you once again to this esteemed speaker, Dr. Alvin Wells. It's been a privilege again working with you, Dr. Wells. I hope to have you back.
Yes.
And of course, Aurinia Pharmaceuticals for sponsoring today's event. And as always, you can check out Dr. Wells on his social media platforms and TikTok. I'm not even on TikTok, Dr. Wells. This is great. I'm going to have to join so I see your content.
Will. Yes.
Yes. I want to see what you're posting. And as always, you can check out Aurinia Pharmaceutical so you learn more about how peeing in a cup, it may suck, but lupus nephritis is a heck of a lot worse, and learn more about their platform. The Arthritis Foundation is a great resource, and then morethanlupus.com for resources and community and support. So thank you again. Thank you, Danny. Thank you, Dr. Wells. And we will see you next time here at More Than Lupus.
Great.
Have a great rest of your week.
Thank you, Kelly. Bye-bye.